we work in a very innovation oriented space, right? I mean, I think healthcare is definitely one of those fields that is always expected to be on the leading edge, to look out for what's next, and to improve care. When let's say, we are looking at how do we support innovation in Canada, whether it's inside healthcare or outside, is that still seen as just being a cost, or is that seen as being an investment? Because that seems to be the one case or the one ministry that should be looking at things more as investments that drive
Yeah.
GDP.
So the irony, right, is that if we think about the way in which we make the case for public in a public insurance environment for a particular drug or therapy, right, it has to go through a highly standardized process of doing a health economics analysis to assess
Yeah.
the quality adjusted life year effect of that particular intervention, whether it's cost effective to do so, right? So we do all of this effort in terms of the insurance system to pick the right sets of interventions that we will fund to make the most cost effective investment. But that's after we've decided how much money we have to spend, right?
Right.
Not before, right? So we don't do it at the first step in deciding could we spend more money, and maybe at the front end expend a little bit of money, but we at the back end will get a real payoff. We decide first on what we can afford to pay. And then once we've decided how much we can afford to pay, then we make decisions in a more rational way to allocate those monies effectively. And that's once it's out of the hands in some ways of a finance minister and it's into a ministry, right? And in some cases, as I think you're getting at there, some of the ways in which those ministries, especially, public health systems, because they have to make decisions as an insurer, are going to be forced to make decisions in ways that are much more focused on cost effectiveness. But this speaks to the entire design of our healthcare system, more or less, in the sense that as 70% of the dollars in our healthcare system are publicly funded, it's effectively a monopsonistic market, right? And so we decide how much healthcare we will have in Canada by virtue of what we can afford. And once we've made that decision, then we decide how to allocate it rationally, or as rationally as possible. But maybe we should actually rethink the first step of that discussion, which is maybe we need more healthcare in order to reduce healthcare, right? But we don't have an ability, at least in our public budgeting systems, to make those decisions more rationally.
But I would expand this even beyond just the investment from a health insurance standpoint, and I would say, researchers who are actually developing new drugs. I mean, the expectation is, I mean, maybe not the expectation. I think the reality in Canada is that for most of these folks who are sitting in a university somewhere, they are selling this off to some other small company, typically outside of Canada, typically across the border, and it gets spun out. Maybe it comes back as a marketed product, or it dies in the vine, as most of these products do. But there really doesn't seem to be the same investment in an ecosystem here to develop our own industry around healthcare, similar to the U.S. And I'm not going to go into capital gains or anything like that. Just more broadly speaking, the investments that sort of create an infrastructure where you can go from a lab in a hospital or a lab in a university to potentially a company that can grow and become an actual, billion
So,
dollar company with people employed.
so I think you've hit on a really interesting point, which is in some ways I think Canadians feel uncomfortable or maybe embarrassed about the economic opportunity associated with healthcare because we've been so conditioned as Canadians in our identity to think that our Medicare system, our publicly funded Medicare system, must mean that there's a very narrow controlled space for the private market, as though the way we pay for something means that we shouldn't be looking at the economic opportunity of those innovations.
Yeah.
And the irony, of course, in all that, as you know, is if you were to look across sectors where we have strengths building on our basic research in Canada, which we still do fairly well as a country, and we still have lots of talent here despite the global arms race for talent that's going on globally. Life sciences and biotechnology and the health system are some of the top two or three sectors that you would want to focus on if you were trying to identify strengths that you wanted to build Canadian champions around, because we have a high amount of research, we have high research impact from the research that is done in those spaces, and we're still relatively cost effective as a place to invest. But what we then don't do, right, is we don't commercialize that very well. And I don't actually know how necessarily to solve that problem, but I would just say from my time in government, I would remember seeing sometimes these news releases that would come up talking about, for example, the economic opportunity in in working with vendors on electronic medical records. And I would say to myself, well, hold on, is this a good thing or is this a bad thing? In the end, it's actually a good thing, but you can understand there's a pause there that a lot of policymakers have, because they're like, well, is innovation in this space, is economic opportunity and commercialization in this space a good thing or not? Is that antithetical to our values as Canadians who believe in a public Medicare system? The answer is no, but I think there's been this hesitation in the policy community as a result of that long-running debate about Medicare that has pulled us away from examining how we push those sectors. Now, post-COVID, I think we're starting to get better at that, especially as we've had to rebuild our biomanufacturing capabilities in Canada. But I would just say I think this is the consequence of having a long-running debate about